Hello, my name is Judy Moreno. I'm an FNP student from Simmons College, and I will be doing a physical assessment today. How are you, sir?
I'm good.
Very good. We will begin with this physical exam with examination of the ears. Looking at the ears anteriorly and posteriorly, I see that it is symmetrical. I don't see any erythema, edema, or any nodules, or any deformity. I'm now going to palpate the pinna. Let me know if there's any tenderness.
No,
The earlobe,
no,
the tragus.
no,
I'm going to tug the ears,
no,
check for any otitis media.
no,
Okay, I note that there's no tenderness, any erythema or edema. I'm going to check the mastoid area, which is behind the ear. Is there any tenderness?
no,
Okay, I note that there is no tenderness or any nodules or any lesion in the mastoid area. I'm now going to check the ear canal. It's important to check in an adult client to pull the pinna up and back for a easier insertion of the otoscope. I note that the ear canal is pale white. I note that there is fine distribution of hair. There is no erythema, edema, or any foreign body or any cerumen. I'm also going to check the same technique on the other side. Same thing, pull the pinna up and back. The ear canal is pale white. There's fine distribution of hair. There's no erythema, edema, any foreign body, or any cerumen. I'm also now going to check the tympanic membrane on this side. The tympanic membrane is pearly gray. I see the bony landmarks is clearly visible. The cone of light on the left ear is found at 7 o'clock. There is no bulging, any perforation, edema, erythema, or any discharge. Moving on to check on the right tympanic membrane. Pull the ear up and back. The tympanic membrane is pearly gray. The bony landmarks are clearly visible. The cone of light on the right is found at 5 o'clock. There is no bulging, any perforation, erythema, edema, lesion, or any foreign body. Moving on to check for the auditory acuity. I'm gonna stand 2 feet away from the client. I'm gonna ask you to cover your left ear and repeat what I will say. Barbecue.
barbecue,
Very good. Going to doing the same technique on the right ear. Can you please cover your right ear? And I'm going to cover my mouth. Football.
football,
Very good. And from this, I can make the assessment that the auditory acuity is intact at a whispered voice at 2 feet. If I have any concerns about his hearing, I would check the Weber test. And to do this, I would use a 512 tuning fork. I'm going to ask you where would you hear the sound? The left ear, right ear, or in the middle?
in the middle,
Very good. And from this, I can make the assessment that the Weber test is intact without any lateralization. And also, if I have a concern about his hearing, I would also do the Rene's test. With this, I would use the same 512 tuning fork. I would place it on his mastoid bone. Let's do the left ear first. Let me know when you don't hear the sound anymore.
no more sound. There is sound.
Very good. We'll check the right ear.
No more sound. There is sound.
Very good. And from this, I can make the assessment that the Rene test is intact. Air conduction is greater than bone conduction. Moving on to the examination of the nose. Looking at the skeleton of his nose, it is midline. I don't see any deviation or any asymmetry. Palpating the nose, I don't feel any nodules or any lesion. Is there any tenderness when I do that?
No,
Very good. Moving on to examination of the nares, I'm going to ask you to occlude your left nostril and blow for me. Very good. Cover the right nostril and blow for me. Very good. And from this, I can make the assessment that the nares are intact. Okay, looking at the nares, I know that there is fine distribution of hair. There is no erythema, edema, or any lesion. Looking now at the mucosa is pink. There's no erythema or lesion or any discharge. Looking at the septum, don't see any deviation or any perforation. And the turbinates are clearly visible. There is no erythema, edema, or any lesion of the turbinates. Checking now the sinuses. Let me know if there's any tenderness. And this is maxillary. Do you feel any tenderness?
No.
Frontal?
No.
Very good. And I note that there is no tenderness in his sinuses. There is no overlying erythema or edema. Moving on to the examination of the mouth, starting with the lips. I see that the lips is pinkish brown, which is appropriate to the client's skin tone. It is symmetric. There's no obvious asymmetry or any deviation. There is no erythema, edema, or any fissuring of the lips. Can you open your mouth? Sting your tongue out. Okay, the tongue protrudes midline, which checks the cranial nerves 12, which I note is intact. The tongue is lightly papillated. It is pink. There is no erythema, edema, or any lesion. Can you lift your tongue up? Okay, I see that the blood vessels are clearly visible. The frenulum is intact. I see a small amount of saliva, which I note that the salivary glands is patent. Looking now at the mucosa is pink. There's no erythema, edema, or any lesion. Looking at the hard and soft palate, it is continuous, it is pink, it is moist. There's no erythema, edema, or any lesion. Looking now at the uvula, can you please say ah?
Ah.
The uvula rises. There's no deviation, erythema or edema. Looking at the tonsils, the anterior and posterior tonsils are present. There is no erythema, edema, or any exudate. Looking at the posterior pharynx, it is pink. Say ah.
Ah.
It is pink and it is moist. The uvula rises symmetrically, which I note it also checks for cranial nerves 9 and 10. The parotid ducts are clearly visible. There's no erythema, edema, or any lesion. Looking out at the dentition, saying, okay, the teeth are white, they're straight. It appears to be in a good alignment. I see a couple of fillings and the molars. There are no caries. Gonna check on the teeth. The teeth appears to be firmly seated on the gingiva. Looking now at the gingiva. Say any. Okay, good. The gingiva is pink. There's no erythema, edema, or any hypertrophy. The examination of the nodes, starting with pre-auricular. Let me know if there's any tenderness.
No.
Post-auricular.
No.
Tonsillar.
No.
Submaxillary.
No.
Submental.
No.
Occipital.
No.
Superficial cervical.
No.
Deep cervical.
No.
Posterior cervical.
No.
Supraclavicular.
No.
Infraclavicular.
No.
Okay. Epitrochlear.
No.
Very good. And for the sake of client's privacy, I will defer the axillary and the inguinal nodes, but the nodes are non-tender and non-palpable. Moving on to the examination of the neck, looking at the trachea. The trachea is midline. It is straight. Can you swallow for me? Very good. The cricoid cartilage rises with swallowing. Looking at the thyroid, it is not visible to inspection. I'm now going to palpate the thyroid. Starting with the right side, I'm going to find the cricoid cartilage and move my fingers below, slightly below the cricoid cartilage. I'm going to ask you to no, tilt your head forward and to the right. I'm gonna deviate the trachea to the right as I palpate the right thyroid. Is there any tenderness?
No.
There is no tenderness. The right thyroid is non-palpable. There's no masses, nodules, or any thyromegaly. Checking out at the left thyroid. Feeling for the cricoid cartilage. Very good. And sliding my finger below it. Deviating the trachea to the left. Can you tilt your head to the left? Very good. Is there any tenderness?
No.
Okay. There's no tenderness on the left thyroid. There's no masses or any nodules or any thyromegaly. Very good. Moving on to the examination of the carotids. The carotids is found medially to the sternocleidomastoid. I'm going to palpate the carotid glands, making sure that I will palpate one side at a time. I note that it is 2+ and regular. Trying to check on the other side. I note that the carotid is 2+ and it is regular. I'm now going to listen for any bruit, making sure to use the bell of the stethoscope. I need you to hold your breath for me. And there is no obvious bruit on the right side of the carotid. Breathe. Very good. Now hold your breath. And I note that there is no bruit on the left side of the carotid. Moving on to the examination of the heart, making sure the patient is laying down on a 30-degree angle. I'm looking at the carotid and the jugular vein. I note that there is a soft undulating pulsation. There is no obvious distension or any bulging of the jugular veins. And looking at the precordium, looking for any heaves or lifts, which I note that there is none. I'm now going to do the precordial palpation. I'm going to start with the aortic area, which is on the right second intercostal space and the right sternal border. And I note that there is no pulsation or thrills. And the pulmonic, which is in the left second intercostal space in the left sternal border. There is no pulsation or thrills. And the tricuspid area, which is in the fifth intercostal space and the left side sternal border. I note that there is no pulsation or thrills. And the mitral area, which is in the fifth intercostal space, mid-clavicular line and the left sternal border. I note that there is no thrills or any pulsation. Moving on to check for the left apical impulse, which is in the left fifth intercostal space. I note that it is present, approximately 1 centimeter in diameter. They're small in amplitude and short in duration. I'm now going to check for the heart rate and rhythm. For the sake of timing, I will not do it of 1 full minute, which is normally what we should do. I will be using my electronic stethoscope, which will tell me the rate. Okay, the rate is 72 beats per minute and regular. I'm now going to check for heart sounds. Going back to the same 4 areas. I'm making sure to use the diaphragm of the stethoscope. I'm going to start with the aortic space. I note that the S2 is louder than S1. There is no murmurs, no S3 or S4. Pulmonic, I note that S2 is louder than S1. There's no rubs, no S3 or S4. Tricuspid. I note that S1 is louder than S2. No rubs, no S3 or S4. And the mitral. I note that S1 is louder than S2. There is no rubs, no S3 or S4. Moving on to the examination for heart murmurs and going through the same 4 areas, starting with the aortic, making sure to listen with the bell of the stethoscope, pulmonic, tricuspid, and mitral. And I note that there are no murmurs. If I have any concern about any mitral murmur, I'm going to ask my client to move to his left side slightly and place the my stethoscope on the mitral area, making sure to use the bell of the stethoscope. And I note that there is none. If I have any concern about any aortic murmur, I'm going to ask you to sit up for me and put the stethoscope in the aortic area and exhale completely. And I note that there is no aortic murmur. Moving on to the examination of the peripheral vascular exam. All throughout this examination, I will make comment of the presence and the quality of the pulse, starting with the temporal. I note that it is 2+ and equal bilaterally. The radial. And I note that the radial pulse is present. It is 2+ and equal bilaterally. The femoral. And for the sake of the client's privacy, I will just do it on top of his clothes. It's hard to feel, very faint. It is 2+ and equal bilaterally. I'm going to check the popliteal pulses. It is present and is 2+ and is equal bilaterally. Dorsalis pedis. I note that it is present. It is 2+ and equal bilaterally. Posterior tibialis. I note that it is present. It's 2+ and equal bilaterally. I'm also going to check for the extremities for any varicosities, superficial or deep varicosities, which I know that there is none. Palpate the legs for any swelling, which I note that there is none. And this concludes our physical exam.